I'm Alex Morash, and let's queer up health. Republican lawmakers clash with medical school leaders over trans men and pregnancy language. Republican lawmakers questioned medical school leaders over inclusive language during a U.S. Education and Workforce Committee hearing on diversity, equity, inclusion in medical education. The hearing, titled Training Activists, Not Physicians, The Impact of DEI on Medical Schools. Scary stuff, people. Featured leaders from the University of California, San Francisco, UCLA, and the University of Illinois. Representative Mary Miller challenged UCSF's Chancellor, Dr. Sam Hawgood, about teaching materials that recommended using the term pregnant people instead of pregnant women in some contexts. Hawgood said the guidance helps prepare students to care for a diverse patient population. Florida Representative Randy Fine then pressed Hawgood on who can be pregnant besides women.
Dr. Hargood, under questioning from Ms. Miller, you said, quote, the vast majority of pregnancies are in women, end quote. Who has the other pregnancies?
It's possible for transgender people.
So wait, so transgender people? I thought a transgender woman was a woman. So you said the vast majority of pregnancies are in women. So who are the other pregnancies?
They don't recognize themselves as a woman.
What?
You heard what I said. They don't transgender.
So there are people who are pregnant who are... Just use your made-up language.
Rare.
Who are the other people who are pregnant in your kooky worldview? You said the vast majority of pregnancies are in women. Who are the other pregnancies in?
A transgender person.
A transgender person. The answer, I presume, in your kooky language would be a transgender man. I don't know why you won't just admit that. A transgender woman would be a man who's pretending to be a woman. So why won't you even say the truth in your own screwed up view of the world, that the other pregnancies are transgender men? Why won't you just say that?
I'm happy to say that.
Okay, so say it.
Transgender men.
Transgender men get pregnant. That is your view. So okay, that's insane.
Fine later posted on Twitter, quote, today in Congress I asked a simple question, who else gets pregnant besides women? The witness said transgender men. I told him that's insane because it is. Men cannot and will never be able to get pregnant, end quote. On the other hand, medical organizations note that transgender men can become pregnant if they retain a uterus and ovaries, and documented cases of trans men giving birth have been reported for years. Well, kids, I am sorry that we have another case about fecal matter with Randy Fine here. Talk about one of the worst human beings in the world. Watching him talk to medical professionals, claiming that they're the kooky ones. And I'm like, I'm sorry, when I see crazy in front of me, I see crazy, and it's not the medical professional in this one.
The linguistic framing here is deliberate. The whole idea that, first of all, trans women are not men pretending to be women. That's a scare language designed to basically tell the Midwestern housewife that, a man pretending to be a girl is going to your girl's restroom and assaulting them. That's the kind of language they drum up to fearmonger away trans rights. And second,
especially because those women should be far more afraid of those other ladies stealing their husbands.
And second of all, the kooky, insane, they are trying to frame, they have been actively, this administration are trying to actively frame anyone who comes out as trans as mentally ill and therefore eligible to be institutionalized or worse.
Well,
that's...
Larry,
yeah, I don't know when this gentleman's going to be up for re-election, but
you
put
every 2 years.
Okay, so people, this is a representative representing Florida. Think about who you're voting for.
I hear you.
Politicians has been trying to masquerade as experts.
But he's a representative of the people, and he's being abusive.
Exactly.
He's not representing all the people by saying things like that.
Oh, and he's terrible with this stuff. He's the same guy that, when he was a state senator, people go and testify, and he'd bicker with them. And I'm like, most lawmakers, if they don't agree with you, they just ignore you.
We can blame our chief, our president, for creating a divisive country. Right. Where people have no respect.
But there's also an important health issue, Bobby. They're deciding to bring doctors and medical professions in to scare people on trans issues when there's actually real health issues going on. There was an LGBTQ reporter that just did a whole big story on how private equity is buying hospitals, and that leads to worse healthcare outcomes. And instead of Congress being worried about that, worried about our lives when we go get medical care, they're harassing trans people and medical professionals. It's disgusting.
And being in healthcare myself in administration, there is an obligation to educate all the staff within the hospital that some people who can have a baby may present as men and they are transgendered, but that's transgendered man can have a baby.
I mean, there are intersex people who
Yes,
are neither
absolutely,
male
good
or
point.
female biologically,
Yes,
who have uterine tissues and can get pregnant.
Yes.
You know, they are not large amounts of cases, but cases exist. And doctors are supposed to treat everyone, not just everyone that's got ideologically approved
And
of by the state.
The patients have a right, and it's not a DEI thing, it's a human thing to treat people humanely.
Exactly.
Bottom line.
It reminds me too, when I first lived in DC, the Whitman Walker Clinic, and on one of the social media, there was a trans man talking specifically about how important this is, because like they were looking for personal care for their body, and they didn't know what materials to look at because all the stuff about uteruses and were only for women, and they weren't sure if any of the materials were for them, and they felt very uncomfortable. It's like, yes, it's perfectly natural to have some documents for trans men to understand their body, for trans women to understand their body. For me, as a weird gay boy, I should have my own little pamphlet about my weird body, for Christ's sake.
Well, on that note about healthcare, there is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by sharing them and subscribing to Queer News Tonight.